As always, I appreciate the opportunity to be on the phone call here and answer questions and generally give you an update on where we are with everything here at the state. Maybe some of the highlights real quick. We do continue to see more cases, and that's nothing else to be alarmed by, right? As we expand testing, we're going to expect to see more cases. And we certainly had some issues over the weekend with a skilled care facility, nursing home, whatever you want to call it, in Blair, where we moved the residents out and are going through a deep cleaning there and testing everybody. We've got another issue with a facility in Papillion, and we'll probably expect to see that as the amount of virus in our state continues to grow. Last week, we did have the 2 first reported deaths from coronavirus, as well as expanding the directed health measures now to 18 different counties. And with the president's press conference yesterday, he said that his 10-person rule will be extended till April 30th, and we will follow that rule as well here in Nebraska till April 30th too. So if you're in a DHM, that will last longer potentially. So Douglas County is at till April 30th, but if you're in some of the other DHMs, they could go till May 6th, and the rest of the state will be operating on the somewhat less restrictive guidelines, but still pretty restrictive, till April 30th. We expect that at least there's a couple different models out there right now. We're doing our own modeling too. But I think if you just want to look at kind of what the general models are saying, that we're probably going to reach the peak here in Nebraska sometime between mid and late April. So at some point, we will reach a peak of the number of cases, and I hope that we are actually on the downhill slide by the time we hit May 1st. Now, obviously, there's no guarantee around that, but that's kind of what some of the modeling shows that we're going to experience here in Nebraska. So April is going to continue to be a very tough month here in Nebraska. And again, I just want to compliment all the superintendents and principals and teachers and janitors, everybody in all of our schools who have been working so hard to be able to provide that education without the kids actually in the classrooms. And, I think that you can expect that, it's probably still going to be pretty difficult for those families that you're continuing to serve over the course of this month. That May looks like, if the modeling is accurate, that we'll be on the downhill slide, though we'll still be managing this in April or in May. And our philosophy will be that as we believe we can loosen restrictions, we will loosen restrictions. But we're not going to be just going, okay, it's May 1st, now all the restrictions are off. We will be gradually loosening those restrictions to make sure that we continue to keep a lid on the virus so it doesn't overwhelm our healthcare systems. We're not, we're going to work very hard to make sure that it doesn't overwhelm our healthcare systems, that we have enough hospital beds, enough ICU beds, enough ventilators, so that we can take care of everybody. But that's another reason why we will not just take the restrictions off 100% on May 1st. And thus, again, Commissioner, to your comments on Friday, that schools should expect that they will not be able to have teachers, or rather children, in their schools this school year. That we're really looking at, the opportunity for kids to return to the classroom is going to be next fall. So that's kind of where we are with regard to this. There's a lot of other things we're talking about. I just continue to encourage everybody to continue to follow those social distancing guidelines we put out there. We saw it was a great weekend, lots of warm weather, people were out. Please remind people, don't have big parties, like birthday parties with a bunch of people. We just had one in Lincoln where the cops had to go bust up a birthday party because they had 30 people at it. Remind your parents that no club sports, right? Don't have a bunch of kids playing together because that's how the virus spreads. So again, keep it to groups of 10 or less, and stable populations are the best. So don't have large groups of friends over. Don't do the big birthday parties. Don't allow them to do club sports. I mean, these are the kind of things we need to continue to focus on, especially in this month of April, where we expect this is going to be the toughest month here in Nebraska. So you all could be so helpful in making sure that we continue to get that message out about what we're doing with regard to that social distancing. And then just finally, to wrap up on the last 2 big issues we're talking about, or we generally talk about, which is PPE and testing. We are expecting some more PPE, personal protection equipment, coming in this week. We're going to be distributing out anything that we get from the state. We'll be going out through our local public health departments, Last Thursday, we sent out a form to all the public health departments to contact people in their community about who needs PPE. So, again, if you know an organization who thinks they need PPE, mask, gowns, surgical masks, that kind of things, those N95 masks, whatever, they should contact their local public health department and get that information to them. We're looking for basically a run rate on a monthly basis, especially during the peak, which would be this month, we think. And then that will help us buy more protective equipment. And then with regard to testing, we have the capacity now to do about 1,000 tests a day between the Public Health Lab, UNMC, organizations like Bryan and CHI. Plus, I think we're over 200 of the private lab, 200 tests a day coming back from the private labs that are out there, the commercial labs, I should say. So what we do is, again, we're prioritizing that around our first responders, law enforcement, emergency management, corrections officers, that group, also healthcare, and then also long-term nursing facilities as kind of the big three priorities we have to be able to make sure that if we need to, we can test those folks in a hurry. So that's where we are with those things, and certainly be available to take questions whenever you're ready to take questions, Commissioner.
Yeah, thank you, Governor. And so I thought maybe you and I could dialogue a little bit. I don't think Gary Antone's on, and if he is, maybe I'll have him text, if he can text me, but I don't see that he's on. But one of the things I think, Governor, I wanted to chat a little bit with you about, I know we've kind of shifted from how we're thinking about the regions, and I was wondering if you could talk to that a little bit as you call the DHM or make those decisions and how that works.
Oh yeah, hey, thank you very much, Commissioner. You just get used to doing so many things that you do one thing, you check it off, and then you got to remember to go back and communicate to everybody. So as you all may recall, when we originally put together our plan, the Commissioner and I, thinking about how this would impact schools, we're going to break up the state into 19 regions based on ESU. And that's what we did for the first few weeks. But now that as schools are generally operating without students and are going to do so for the rest of the school year, we are switching to a model of breaking up the state regionally by public health district. And there are also 19 of those, and they overlap in large part with our ESUs. So it's a good fit from that standpoint. It just breaks up a little bit easier because we don't go over county lines. And so it's easier for us to issue a directed health measure for specific counties because then it's more clear about who we're impacting. And so going forward, our DHMs will be on public health district, like the Three Rivers District, which includes, Dodge, Saunders, and Washington County as an example. So we will be doing that as opposed to the ESU because the schools are not going to be operating with students for the rest of the school year anyway. And again, as we loosen restrictions, hopefully we'll be loosening them into the summer, and we'll know more about the school year next year. But since it's not as relevant to schools, we changed the methodology.
So yeah, thanks for that explanation, Governor, because I know this is our first statewide call since that happened anyway. So I thought it'd be helpful to kind of describe that. Again, as we kind of keep working together on that, I think the other question I get a lot, Governor, is what about graduations and other types of features that might take place during the year? Do you want to, maybe you and I can dialogue about that for a second here, but
Sure. Well, again, the 10-person rule is in effect till the end of April. I would not expect to be able to hold any large-scale graduations till the second half of the summer. And even then, it may be limited to the number of people you can have. And it really just depends on where we think we are with the virus. And this has been something, remember, that we communicated our original plan back on March 13th, which seems like a long time ago, but really wasn't. That was only just over a couple weeks ago. So this does tend to move quickly, and we'll have to wait and see how this all pans out. But I think it's pretty safe to say that you will not be able to have, obviously, certainly while we're under the 10-person rule, but really in May, I think it's really unlikely you're going to be able to have any graduation ceremonies unless you're a really, really small school.
Yeah, so thanks for that. Hey, I do see that Gary Antone is on, and Gary, are you able to speak now?
Yes, can you hear me now, Matt?
Yeah, I sure can.
Okay, well, the Governor Ricketts pretty much stole my thunder, so I don't really have a whole lot to add. except I remember one time, Matt, you told me that the state of Nebraska has a hook pattern, and if you look at the map, that's exactly what it's looking like right now. And, you know, obviously, the Panhandle will be next, and like the governor said, we had our first nursing home real issue this weekend, but the plan we had in place seemed to work great as far as getting the residents taken care of. And, you know, it's sort of, we're learning as we go, and so far no major issues though as far as public health goes. We are seeing a little bit of an uptick in the percent of patients that are testing positive now. So nothing substantial or significant, but just a trend we're seeing. And I think that percentage will probably go down as we do expand testing, but we're still using the same guidelines of testing, obviously inpatients that are ill, first responders, state patrol, policemen, healthcare workers, and long-term or nursing home residents and staff. Those are our priorities still at this time.
Hey, Gary, can I just jump in there for a second? This is the governor again. So I think right now, even with the high-risk categories we're testing, we're right around just a little over 5%
Yes.
test positive. Is that accurate?
Yes, right around 5%. And like today with the new numbers that Matt has on the dashboard screen there, it's around 5.3% now.
Yeah, and so just to put that in context, the mayor of DC was on our call with the president today, and they're testing around 12% of the people they test are testing positive.
So, yeah, so I mean, do we expect that to grow? Is that what you're thinking during the month of April then?
I'm thinking the percentage will probably go down as we start testing the less or the more broadened testing. So more people that probably have less of a risk to be positive will be tested.
Okay. All right. Well, that's very helpful information. So the next slide I have, maybe we've kind of already talked about a little bit, but if I can get my slide to advance. There, I got it.
Hey, and Gary, you might as well weigh in on the whole graduation ceremony thing too, if you have any additional thoughts beyond what I said.
Not really, Governor.
So maybe kind of along those lines, though, Governor and Gary, you know, kind of we've talked about how long this will last already a little bit. You know, is there, I mean, I guess one of the questions that we continue to get is kind of how do we know when the all clear kind of comes? I mean, what's that process looking like as you get into the, say, the middle of April with the DHMs that are ending? Is there a process that you're anticipating that those kind of extend, or how do you see that working?
Yeah, we're going to be working with the federal government to get some feedback from CDC with regard to that. The president kind of indicated already they're working on some models for that. Plus, we'll be working with UNMC with regard to what their feedback is, which is really kind of what we've done for this whole process. And I think one of the things that Dr. Antone said about learning this as we go, you know, we haven't done a pandemic here in this country in over a century. So part of this is we are still learning, but it'll be done in consultation with the experts that we have to kind of decide what are those signals. I think the key thing I can tell you right now we know about it is it will not be, went from 10 people to no restrictions at all. We will gradually loosen the restrictions to maybe, you know, go up to a higher number of people allowed at events, allow restaurants to start having dine-in customers again, you know, that kind of thing. But it's not going to be a, you know, all rules are off, all bets are off kind of thing right away. It will be gradually over time. You know, it may be, you know, over a period of a month or 2 months at the shortest. It could be longer.
I did hear an interesting thing today about New York, which I think is probably one of the ways we'll know that answer of when things are getting better. And that is they're seeing just as many discharges now as they're seeing admissions. So that'll be a good sign. We're going to see an increase in our hospital admissions. Right now, we don't have very many, only around 20, 25 across the state. But as we start seeing more admissions, that's when we know we'll hit our peak. And then when we start seeing discharges, more discharges than admissions, I think that's one of the signs that things are getting better.
Yeah, I very much appreciate that. So as far as as far as kind of where else we go, maybe into the summer, what are your thoughts that schools might be trying to offer any type of summer activities or summer school at this point? Is it too early to know, or when do we start thinking about that as far as a planning purpose from kind of your health perspective right now?
All right, Gary, I'm going to take a shot at it. Jump in if you disagree. I'm going to give you a guess. We're going to need to get to the end of May to really know.
Okay.
Because if we actually hit our peak, as the model suggests, in mid to late April, and we're reaching the tail going off in May, we'll know more about what you can do in June, July, and August before the school year starts. But I think we really need to have more data with regard to what this is looking like going through April and May. And Gary, you disagree?
No, I would agree with that. Yes, I think right now from our preliminary data, it looks like mid to late April is when we'll hit our peak. And then hopefully things will settle down in May and we'll have more of an answer by June.
And frankly, again, a lot will also depend on how well the state continues to follow the guidelines, right? If people continue to follow all the rules about staying home when they're sick, avoiding 10 people or more than 10 people public gatherings, bars don't have more than 10 people in them outside the DHMs, all that sort of stuff. If we do a really good job of following all the guidelines with regard to social distancing, this could make this a lot better and maybe shorter as well, if we can actually get it killed off in our state.
So I think that's helpful, and it's just kind of helpful it is hard to plan in this environment, I know, from everyone's perspective, but that's just our reality right now. So I appreciate you.
Yeah.
Your
hey, one of the other questions, Commissioner, that I did get was about a bounce back, and could we see a second wave of this in the fall? Mm-hmm. And of course, there's so much we don't know about it that is always possible. But that gets back to we will really try to keep the lid on this thing so that we do not see a bounce back, which is why when we loosen restrictions, we're going to loosen them a little bit at a time to make sure we're not seeing too much of a bounce back and can maintain it and manage it. So that's certainly one of the things that we have in mind when we're thinking about when will we start loosening these restrictions. And if you see people who think they're not loosening fast enough, it's again with that in mind that we don't want to see a bounce back of more cases.
Yeah. No, that's very appreciated. And I heard you today, Governor, in your press conference kind of reiterate the length of time as far as not being in a position to plan to be back to school in this session. And I know we have schools that are, trying to balance between their needs at their community level. I did this weekend send a note to actually to the school board members through the Nebraska Association of School Boards, just kind of with that same message that I think you and I chatted about on Friday. And again, I think we get questions because some areas of the state don't feel as impacted right now, but I think that's quickly changing, obviously. So I appreciate everything you all have done to keep us informed. So thanks for all of that.
Yeah, I mean, we do have over half the state's population is a directed health measure right now, and that's only after about a little over 2 weeks.
Yeah.
So it can move quickly, and even if areas of the state are not being impacted now, again, if you get a community case that's spreading, you will be under a DHM, and in fact, that will be going into May now. Because already the ones we're issuing now are May 6th, so you can expect the ones that we do after this will be a later date.
Yeah. All right. Well, thank you for that. I'm going to move on a little bit, and I'm going to ask Dan Schnoes from ESU 3 to join me. I've been trying to work with the ESUs around kind of how do we regionalize conversations to ensure that we can answer questions at kind of either a regional level or be able to discuss kind of strategies that might take place. And then also really appreciative of the ESUs and school districts working with their local health regions as part of that strategy as well. But Dan, are you able to talk? Can we have you unmuted?
Yes, can you hear me okay?
Yeah, I sure can. So among the approaches that I've asked the ESUs to think about with me a little bit, and I think we'll start to implement, is every week they're having, and I think it by ESU, having conversations with all their school superintendents and also their private school leaders as well. And my hope is to be able to kind of get to the end of a week with a set of questions that we've kind of explored region by region. And I think that's going to be very helpful. And Dan, do you want to kind of add anything to that on the types of approaches that might be helpful for me to consider or for us to consider across the state?
Well, first of all, on behalf of all the ESUs, and I think if I could speak for a number of our school districts across the state, we sure appreciate the work that Governor Ricketts does, and along with Commissioner Bloomstead and all your staff and all the health departments. I have never in my 30 plus years of being a school administrator seen the team pulled together in such a quick movement and a valuable movement of personnel across the state to help us deal with these issues. You know, we're educators, we're about families, kids, and taking care of our staff. And those are the conversations that we're having with our ESUs. Currently, our ESU administration of all of our ESUs across the state are meeting twice a week to field all the questions that we have, and we're bringing topics back to our group. I think every ESU is meeting 1, 2, or 3 times with their local superintendents, and hopefully being able to share information as well as bring information back. And the local health departments have been really super in connecting to a lot of those meetings. And as the governor said, you know, we're getting a clearer picture of what the end of the school year is probably going to look like for us. You know, some of us are still hoping, but it's actually a good sign to see if the peak is coming maybe a little earlier than we thought. But we're really starting to focus a lot of our conversations on the logistical part of closing up a school year, which is no small task on a normal year, but now being thrown with all these curveballs. You know, our schools have a lot of questions about how they're finishing things with fairness and equity and really taking care of all their kids, not to mention all their employees.
I think it's a great point, and I just really want to reiterate my gratitude for all the ESUs and their work. I'm going to be joining, I think, ESU administrators and the ESU Coordinating Council twice a week in conversations just to kind of keep tabs on that. And I just want to encourage everyone from the school perspective to really use those regional conversations as a way for us to gather questions and best practices and thoughts from around the state. I think that's been really helpful, kind of like the governor's point about you know, working with our federal partners too. I think us doing our state partnership work has been very helpful for us being able to get that word out. So thanks, Dan, and thanks to all the ESUs for your ongoing efforts. Very much appreciate all of that. So I guess my next slide is kind of just, I want you to also understand, as we keep doing that by ESUs, we've always got, are continuing to post new information on our website for information that's happening here. And we're also constantly working on frequently asked questions right now and gathering up information as we can. I have a few more slides that I'm going to engage some of our staff in some conversations just to give you a little update on some of the key areas that we're working on. And then we'll be able to wrap up after that. So I wanted to start with, and I'm going to ask Sharon Davis to join me in a little bit of the conversation just to give an update on where we're at with food and food security and school meals and at least the perspective that we have at the state level. I've seen great things happening all over from Twitter and other feeds. So thanks to everyone's efforts on that front. So Sharon, are you on now?
Yes, I'm on. Thanks so much for the opportunity, and hopefully we can shed some light on all the information for school meals. We are currently up to, I believe, 15 national waivers now. Not all of them are related particularly to school lunch operations. Some of them have to do with monitoring of administrative reviews and those types of things. But I wanted to make sure that all the schools understood, since they're a nationwide waiver, As long as the state agency opts in, which NDE did, we opted into all the waivers. There's no need for the schools to submit a waiver request to the state agency or to the Office of Nutrition Services. It's an automatic thing. We try to send out those waivers to everyone. I think we're caught up except for the last 5 that came out this morning. So what happened with those waivers is it allowed some flexibilities for schools to serve meals. And right now, based on the survey, you can see Dr. Blumstead put down in the corner, we did a survey and we had 241 responses. There's 82% of almost 82% of the schools that were surveyed are providing some kind of meal. So I think we've had a really good response. And there's different options that those schools are providing the meals. Schools can continue through the school lunch operation. So if they are delivering meals or giving meals to students and they're able to identify those students by their enrollment and can identify them as free, reduced, and paid, they just go ahead and submit their application that way. The second option is if they have more than 50% free and reduced student population, then they can operate in the summer feeding program. And that allows them to operate as an open site where they can give food to all children in the community ages 1 to 18. Nebraska's free and reduced total population for the state sits around 43%. So we have a lot of schools that don't fall in that category of being able to have, hit that 50% free and reduced for students in that population group. So the other option for those schools that don't meet that 50% is to survey or operate as a closed enrolled site. We have a lot of schools that are doing that just because they weren't able to meet that free and reduced population, that 50%. So along those lines, I think we're doing a great job. The other day on the news, I saw blocks and blocks and blocks of cars lined up at OPS and for Papillion La Vista schools in line to receive meals. And so I think we're doing a pretty good job. And we're trying to field all the application questions and get through the process of those summer food applications for those that aren't familiar with the process. We're sitting at over 50% of those have been approved, and so they're all set to go. The other piece on that is thinking about a lot of schools are doing delivery of food, and that's an allowable method rather than having them come to the school and pick the food up. It helps with that social distancing that's important. And so just some food safety concerns that we want to remind people is making sure that as you're transporting the food, that the food is in a temperature controlled environment, kept cold if it needs to be, or hot. And then also, if you're doing multiple meals for multiple days, you want to make sure that you have some kind of messaging on the package that ensures the food safety and tells the families to refrigerate those extra bags of meals that aren't going to be consumed. I think as far as challenges, some of the challenges that are listed there, I've talked about a little bit about, making sure the food safety piece is very important, and the drive-up methods, depending upon which one of the summer food programs you're operating as, an enclosed site or an open site, there is some information that has to be collected about where those meals are going. So if you have questions about any of that process, I know Katie Parch, our section director did a series of training last week, some webinars, and then there'll be a recorded webinar available on our website too. So if you have questions about those types of processes, make sure you call us or look at the website for instructions on that webinar. I think I covered everything on the list so far. Is there any specific questions?
No, I think
Hi,
that.
hey, this is Governor Ricketts. Hey, Commissioner, can I jump in real quick?
Yeah, sure.
I just want to flag something. I was talking to Senator Joni Albright this weekend, and she had expressed a concern about the Omaha tribe up in Macy apparently for a while they were not providing meals. I think maybe they are now, but I just wanted to flag that for you. I didn't know if you had heard anything, but that might be an area where somebody might need some help in putting together a program and making sure all the kids are being taken care of. Thanks.
Yeah, thanks for flagging that. So we'll double check on that. In fact, Governor, as you mentioned that, it just hit me around kind of I know you had the hand sanitizer issue, and I've been asked by the Santee folks how they get hand sanitizer. So I don't know if you know where to direct us for that purpose too.
So, and any of those requests, including for the tribes, should go to the local public health department.
Very good. Yeah.
So that's how we're going to distribute it. So that again, as I said in my press conference today, we're not going to be selling it, but we will distribute it to those public health departments. So they should make a request through there. Okay,
perfect. Thank you very much for that. So Sharon, the main point really for this is, here's that background. Our intention is to be able to help school by school as they need, and we've got information up there, but I know Sharon and team are working pretty hard to address all those questions. So I thank everybody for their attention to this food security issue as well. So thanks, Sharon.
You bet.
I want to jump to the continuity of learning plans, and Corey Epler, I think, is going to join for a couple of minutes on this front. What we've tried to do is create a very simple, straightforward process for folks to tell us kind of how, basically two big questions: how do you plan to serve your students, and how do you plan to serve students with disabilities? And I'll have Corey kind of talk through that. But this idea is basically that you would be able to fill this out in about a half an hour or less. We're not looking for every detail right at this moment in time, but we're also looking for an approach that we can begin to look at information and share that and talk with others about how we can help everyone address their continuity of learning. So Corey, you want to talk to this for a while?
Yep. Great. Thanks, Dr. Blimstead. I think the key piece around the continuity of learning plan is continuing to recognize that the recommendation is that schools will be in an alternate learning environment for the remainder of the school year. And with that recommendation, what does that mean for the continuation of learning for our students? I think one thing that is really important in this space is to continue messaging that school isn't canceled. I think we have to message that school is still happening in this different space. And so learning will hopefully still be occurring, enrichment will be occurring, but I think that mindset for not only our students and educators, but also for our parents as well is a really important message. Like the commissioner mentioned, we've tried, and I believe we've been successful at creating a very simple process for districts to submit continuity of learning plans around those two questions that are on the slide and that the commissioner had mentioned. We have two separate forms, one for public schools and another for non-public. And I would just say if folks are having challenges submitting or have questions, they can certainly reach out to me directly. We've made it where you can simply link to a document that you have already created, or if you've got a plan that you want to upload, that's been able to be done as well. A couple of just general thoughts as districts are thinking about continuity of learning plans. I think one of the big critical considerations in this space is equity, and really utilizing an equity lens as these plans are being built. And specifically, I could call out e-learning in this space because some districts and schools may have the capacity and capabilities of moving to e-learning for continuation of learning, but all districts might not. And even within a district, there may be places where students don't have access to the internet or to devices. So we think that that's really important as we think about the continuation of learning is using that equity lens. And that also would be applicable to our students with disabilities, our English learners, our students of poverty, students of color, etc. So I think that's something that's really critical in this space, and which is why I've been really pleased in how we've been able to have messaging that's consistent with the Office of Special Education as well. So not looking at information coming out as two separate offices, but again, thinking about how we support the continuation of learning for all students. We're asking that the forms be submitted by the end of this week. Certainly, if folks need extra time or some support, they can just reach out to me, and we can kind of go from there.
All right, thanks, Corey. So I think I'm just going to go ahead and move right into the conversation around special education as well, because they are linked. And I think Amy Rohn is going to join me for part of this conversation, and maybe Steve Milliken. Amy, I think you started officially in the director or administrator of special ed like 2 weeks ago or something like that. Is that correct?
Yeah, that's correct. Actually, today's my official first day.
Oh, okay. Today's your first day. So I'll let all the hard questions go your way. So,
But I've been serving in the capacity, I guess, for the last couple of weeks. Yes.
so, well, would you give us a rundown of special ed as we know it, and point folks towards the guidance we've started to compile?
Yes. So like Corey said, the idea around this is that your continuity of learning plan will be contained in both spaces with regular or non-disabled peers and students with disabilities. So we're very excited about people's thinking around this and how you're going to think about what you're providing to all students as we talk about equity. But the educational opportunities that are provided to all students during a closure must include that provision of special education and related services as directed per the individual education plans. This requirement ensures students with and without disabilities are treated equitably. The requirement is also required by federal and state anti-discrimination laws, as you can see there, Title II of the ADA, Section 504 of the Rehabilitation Act, and then also IDEA are considerations in this. So regardless of what you're calling it, call it educational opportunities, enrichment opportunities, all have to be accessible to the student with disabilities, whatever that disability may be. So if you're providing packets, if you're providing e-learning or distance learning or whatever platform that is, making sure that the students with disabilities have equal access to that per their disability. We really just ask that school districts and school system leaders should consider the use of accessible distance technology, potentially the use of small groups within a Zoom setting or an electronic platform, so that students with disabilities can have access to non-disabled peers, instructional phone calls, or other content-based activities. We also ask that school staff and staff from other impacted agencies or facilities, for example, your level 3 placements or potentially contracted service providers or service agencies, that you really bring those into your planning efforts as they bring expertise regarding services to students with disabilities that can be embedded into your continuous learning plans. There's also lots and lots of guidance that we have really been working hard to provide you on not only the NDE's homepage, the coronavirus updates and information page, but also on the Office of Special Education's page, which is education.ne.gov/SPED, SPED. And I think the one that I'll draw your attention to the most is the NDE question and answer. We've tried to take all the questions that we get from everyone and put it into a question and answer document. But we start this document with a quote from the statement of facts around from OSEP's guidance that states, ensuring compliance with the Individuals with Disability Education Act, IDEA, Section 504 of the Rehabilitation Act, and Title II of the Americans with Disabilities Act should not prevent any school from offering educational programs through distance instruction. So we just really want to encourage you, if you have any questions about how you are supposed to be providing services, if you have any thoughts around how you should not be providing services, please reach out to me and anyone on my team, as we'd love to talk you through how this can work best for your district, as we know there's lots of challenges that are different for all. And so we really want to engage you in that conversation. We also have our statewide special education directors call, very similar to this one, tomorrow. We have this every month, the last day of every month, but tomorrow's will be specifically around how you can provide educational opportunities to students with disabilities during this coronavirus pandemic. So tune in to that. If you are wanting that information, contact your special education director either at your district or at your ESU for that information. It did go out to all superintendents and SPED directors.
So thanks for all that, Amy. One thing I wanted to highlight, and if the governor's still on, I wanted to thank the governor for, I know when we started hearing concerns around special education and FAPE, I know you were able to at least kind of raise that point at a national level, and I appreciated that. I don't know if there's anything you want to add on that front, Governor, but.
You know, I brought it up on the call with the president. I don't know if that helped at all for the Department of Education to get out some more clarification, but we were certainly trying to raise the profile of it.
Yeah, no, and I appreciate that. And Steve Milliken's on the call, I think, as well. Steve is our one of my three deputies, and Steve is also the, I don't know what the title is, Steve, but president of the National Association of State Directors of Special Education. So, Steve, do you have anything to add on the national scene right now?
Absolutely, and thank you for that, Matt. And Amy, thank you very much for that update that you gave us and for stepping it up as director in a time of crisis. You've done a great job communicating statewide. And yes, we do, just briefly, because we're at the last 15 minutes of the hour call here, but on the federal level, NASD is the group of which I work with. We are partnering with another couple associations to really continue to work with guidance from the Office of Special Education. And basically, in a nutshell, it's not to waive any services, not to waive any of the requirements, but working on potential extensions of timelines and so forth. And we believe that the work we're putting together, actually today, they're asking for it by tomorrow morning, would give the Secretary of Education the ability to extend timelines specific to paperwork, IEPs, notifications, even potential MOE, not an elimination of services to be given right now, but not to have to worry about whether we do it on the right dates and so forth. So just extensions of those kinds of things. But we are still putting all of that together. We're hoping, but I tell you what, with the governor and the commissioner's support at the federal level and the communications, it's really making a difference. And so we very much appreciate that, and we'll keep moving forward.
Yeah, thanks, Steve. And so I just wanted everyone to know that I think we're actually somewhat in a leadership role of trying to move that and also balance with obviously the needs of our special ed students and the chance for addressing students with disabilities as effectively as possible in this environment. It's truly not just a Nebraska issue, it's truly a national issue. And so thanks for everyone's efforts and attention to that as we keep going. I wanted to kind of quickly highlight that our assessment and accountability waivers were, I guess, approved by the U.S. Department of Education last week on March 25th. That was a very quick turnaround, and we've appreciated that. I will be starting to have some conversations and want folks to have conversations about how can we kind of shift what we've done on statewide assessment to be thoughtful about an environment that how do we measure and benchmark where students are at as they're coming back to school, both in the sense of hopefully next fall, and as we'll keep watching the timelines there, but also how do we do that? How do we know what, learning loss, and I don't mean from a state level, but from a classroom level, how can we kind of shift our focus on those fronts? And I just want to reiterate that we're trying to make it as smooth as possible. I know rules, I keep saying rules and regulations should not be the priority during this time. I think the one area that's been probably most difficult for us on that front has been around special education and serving students in an equitable fashion. But we'll continue to work on that and really appreciate everyone's attention. And it's challenging times, but you know, our team's really working hard with your teams to try to get those things resolved. And I really have appreciated everyone's focus and attention on those fronts. I'm just going to throw out there graduation, and I think maybe the timeline issue is what, as the governor had already mentioned, I mean, not to expect anything even in May, and we'll have to keep watching that data. As far as students actually graduating, you know, that's not just the ceremony, but obviously preparing on those fronts so you can officially have students graduating in their senior year. I would actually encourage some of these conversations at a regional level. I've had a lot of good ideas thrown out. One thing I've learned in this crisis moment is a lot of you are listening to me, and I'm trying not to answer wrong for anyone in the sense that what might work in one school might not work in another. And so I'm going to encourage you to keep working collaboratively and sharing ideas and using those kind of regional areas as a way to kind of figure some of that out so we can come up with some best practices from across the state. I think practices that address the you know, really what your students are needing and some certainty around that is going to be important. And frankly, you have a lot of flexibility to do that under the current system. And but I know it's a challenging time, and we'll keep working with you on that and keep having those conversations with all of you. So I want to kind of wrap up. You know, number one, I'm really amazed at the state of Nebraska, and I thank everyone for their ongoing efforts. I want you to stay involved through every way that we can help. I know I've gotten texts and emails probably just since we've been on. I'll respond to those as quickly as we can. Our team's working very, very hard. I ask you to, you know, continue to submit your questions to our website that has that kind of contact form, and hopefully be able to keep answering those things as we go. Just appreciate everything that everyone's done. Governor, I thought you looked good on CNN. I'm by the way, I have a picture behind me, but it's not as good as the picture you had. So thanks for your leadership, Governor, and anything you would like to say in conclusion.
Well, Commissioner, again, I really appreciate the great close working relationship we have. I want to thank all of our educators here for all they're doing to adapt to very trying circumstances, to make sure that kids stay healthy and get educated. And we'll get through this together like we always do. You know, as Nebraskans, we work together. That's one of the strengths of our state. We work together well. We collaborate. I think that's really come to be highlighted during this emergency we've got here, and I really appreciate it. And like I said, we'll all get through this together.
No, thanks a lot, Governor, and the feeling's quite mutual. So with that, we'll go ahead and wrap up. And again, we'll keep this process going of regular communication on Mondays. Thanks to everyone. Thanks to my staff that worked so hard. And thanks to all of you on the call for both your support and your leadership and guidance all along the way. So take care, everyone. Thank you.
Thanks. Bye-bye.